Bismillahirrahmanirrahim. As I am talking about the special toxicology, and this is the fourth lecture, and we're discussing corrosives. And today I'll be discussing the uh, hydrochloric acid. Hydrochloric acid is also known as muriatic acid or spirit of salts, and it is present in colorless gas, which is which emits very irritating odor. But when it is dissolved in water, because it has strong affinity and extremely soluble in water, and it appears as light yellow in color, and this liquid form, that when hydrochloric acid gas is dissolved in water, it is uh, strong a strong acid. Commonly, it is used in houses and in various uh, places for cleaning agent, and its strong acids, they emit fumes slightly higher temperature than normal. It emit fumes which are quite irritating, and it affects our eyes and upper respiratory passages. Regarding the signs and symptoms, the similar as other mineral acids, the symptoms are mild, but the respiratory symptoms, they are more marked. And these respiratory symptoms, they are because of the fumes, strong solutions of hydrochloric acid which emits fumes, and they are irritating and affecting the respiratory passages. Normally, it does not stain skin or mucous membrane except when it is concentrated form. When it is strong, highly concentrated, then it stains. It, when comes in contact with the alimentary canal, that is when it ingested, it does not cause perforation of the stomach, and only the inhalation of fumes, they cause intense irritation of upper respiratory passages like throat, and even down when they enter into the lungs, which causes suffocation, bronchitis, coughing, and dyspnea. And this is because of the effect on the glottis and larynx. There is effect of suffocation, feeling of suffocation. Now, regarding the fatal dose and fatal period, it is 20 to 30 cc or milliliters of strong acid is fatal. And regarding the fatal period, it is delayed, maybe 24 to 30 hours, but sometimes it is rapid when there is intense edema of the larynx and glottis because of the fumes coming in contact and causing intense spasm, and then the death is rapid. Regarding the postmortem appearance, in concentrated state, the skin and tissues, they are whitened or blackened. Immediately, it is a colorless or slightly yellow, but when the time passes, they are converted into whitened or blackened tissues. The acute inflammatory signs, the edema of respiratory passages and lung, it is found in postmortem appearance. Regarding the medical legal aspects, it is most common mode of suicide in the past, but vitriol in concentrated form is also employed. Accidental deaths when the acid is stored in common shelves or cupboards mixed with beverages because of carelessness, then it can cause accidental ingestion and death. Used in forgery and household cleaning and in labs and pharmaceuticals. So, because of these effects, it can come in contact with workers and the lab attendants and the other persons working in the lab. Now, after discussing in the previous three lectures where I discussed sulfuric acid, nitric acid, and hydrochloric acid, now a brief comparison of these inorganic acids. The sulfuric acid, nitric acid, and hydrochloric acid, the common uses of sulfuric acid, it is used in batteries, pipes, and drain cleaner. And nitric acid is used in ornaments and gold industry for isolation or separation of the gold, and the paint preparations. And the hydrochloric acid is commonly used as toilet and floor cleaner. Regarding the mode of action, the sulfuric acid is strong corrosive. It corrodes, coagulates, and dehydrates. Whereas the nitric acid, when it comes in contact with the tissues, it performs xanthoprotic reaction, in which is that the tissues appear yellow. Then the hydrochloric acid, when it comes in contact with tissue, it erodes, it causes erosions. Regarding the signs and symptoms, sulfuric acid, it causes intense thirst, erosion of the mouth, lips, and causes dyspnea. Whereas the nitric acid, the tissue are stained yellow, there is lacrimation, irritation due to fumes. Similarly, the hydrochloric acid causes intense thirst, dyspnea, dysphagia, and pain, and this is also because of the fumes. Regarding the fatal dose of sulfuric acid is quite low, 5 to 10 ml. Nitric acid is 10 to 15 ml, and hydrochloric acid is 15 to 30 ml. Regarding the fatal period, the sulfuric acid, it is usually within 12 hours, and nitric acid within 24 hours, and in hydrochloric acid it is delayed up to 30 hours. But in all these stages, the death can be acute because of the strong action of its fumes, their fumes into respiratory passages, the glottis and the larynx, causing intense spasm, and death can occur immediately. Regarding the medical legal aspects, the sulfuric acid usually it is accidental in all three cases, and in sulfuric acid cases, it is sometimes used as abortifacient and vitriology. Nitric acid is also used in vitriology, and hydrochloric acid similar as vitriology. Thank you very much.